How are you?
I'm good.
So, how's your posting?
Oh, it's going good.
Okay, by the way, I'm Dr. Ankur, one of the doctors in the department.
Oh yeah, I know about it.
Okay, that's great. So, how can I help you today?
I've been told that you are going to teach me BLS. Actually, I missed my class last Friday, you know.
Oh, no worries. I'll tell you how we do BLS. No worries about that.
Okay.
Okay, so first of all, could you please tell me what idea you have about BLS?
I think this is a basic life sport. Okay, and we have to do something to save someone's life. I don't know exactly what it is.
Oh, okay, that's great. I'll tell you what exactly is BLS.
Okay.
As you mentioned, basic life support. Yes, it is basic life support. So what we do here is we do chest compression and we give rescue breath to our patient.
Okay.
In order to just take over the function of heart and lungs.
Okay.
You know, and any idea why we do? I mean, what are the patients? Which patients we do BLS?
I think the patient who are unconscious
Yes.
and who are not breathing properly, I guess.
Yes, the patient. If patient is unconscious, or patients are not breathing, or if patient is not breathing properly.
Okay.
So what we do, as I mentioned, we do chest compression and rescue breath in order to just take over the function of heart and lungs. Okay.
Yeah.
So let's start it. Okay. So the first thing, before you start the procedure, before you start doing this basic life support, what we have to do is we have to make sure there should not be any danger. I mean, we have to make sure our safety, our patients or victims' safety, or safety of the bystander. Okay, that's our main priority.
Okay.
So just look for any, if the patient or victim is in the middle of the road, or if there is any wire nearby, so just make sure you are away from that. Okay. So once we have made everything is safe, then we'll start the thing. Okay. The next point is response. Okay. So we have to check whether patient is conscious or unconscious. Okay. So let's come down. So what we have to do is we have to check the response. So how we'll check the response? We'll just tap on the shoulder like this. Hello? Hello? Can you hear me? So if there is no response, this means patient is unconscious.
Yes.
Okay. So that was the second step. First was we make sure that there is no danger. Second is we check the response. So if patient is unconscious or patient is not responding, we will shout for help. So shout for help in all the directions. Help, 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 help. Okay. And wait for if somebody comes. And what we can do in the meantime, just check for airway and breathing. So how we check airway and breathing? So there's a maneuver that's called head tilt and chin lift. Yeah. So what we do, we put our hand on the head and we tilt the head and lift the chin with 2 fingers. Make sure you don't put these 2 fingers on the soft part. Just on the bony part. Okay, and with the help of thumb, you can open the mouth a bit. If there is any foreign body, you can take it out. Okay. So this is how we check airway. Now we have to check for breathing. So for breathing, we have to look for 3 things. Keep maintaining this head tilt and chin lift, and look for the chest rise and fall. Look and then feel for the breath sound on your cheek, and listen for the breath sounds. This is what we do. But make sure keep maintaining this head tilt and chin lift. Okay. So this is what we did, airway and breathing. Okay. After that, the next step is call. We have to make a call. We have to call 999. If somebody is around, you can tell them they can call 999 and they can ask for AED.
What's AED, doctor?
AED is it's automated external defibrillator. So that we have to use in the patient if we have any. And if you see that there is no one around, so what we can do at that time, we can just take out our phone, put it on a speaker mode and dial 999 and ask for help and ask for AED. Okay.
Yes.
So there's a step before you do chest compression rescue breath, you have to make sure you follow these steps. Okay. If at any point, if you have any doubt, just ask me. Just stop me, I'll explain it again. Fine? Okay, so let's start chest compression. So what we have to do, just make sure where is this is sternum. So just put your heel of one hand, or you can say dominant hand, on the lower part of the sternum.
Lower part.
Yeah. Make sure you don't press this ziphy sternum. Yeah. Just on the lower part of the sternum. Heel of your dominant hand over any hand. Then interlock it with other hand. Okay. And make sure your elbows are straight. And shoulder is perpendicular to patient's shoulder. Okay. And we have to give 30 chest compression, followed by 2 rescue breath.
2 rescue breaths.
Yeah. So 30 chest compression and 2 rescue breaths.
2 rescue breaths.
And make sure the rate of chest compression should be around 100 to 120 per minute.
Okay.
And it will be around, say, 2 per second.
2 per second.
Yeah.
Okay.
So, heel of our dominant hand on the lower part of the sternum, interlock it, make sure your elbows are straight, shoulder is perpendicular to the victim shoulder, and the rate should be 100 to 120 per minute. And we have to give 30 chest compression, followed by 2 rest breaths. And make sure when you give chest compression, just count it loud.
Okay.
Okay. So let me show you some of the chest compression. Okay. Let's see. So like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, and one more thing, when we are giving chest compression, chest should at least go 5 to 6 centimeter deep. Okay. It's around 1/3 of the patient's chest.
Okay.
Yeah.
Okay.
So this is how we have to do chest compression. So once we have done with the chest compression, we have to do rescue breath.
Rescue breaths. Okay.
So how we rescue breath? So in this, again, you have to follow the same manual. Same manual means the head tilt,
chin lift,
and chin lift.
Okay.
Head tilt and chin lift. But just one thing that you have to make sure is you have to pinch the nose this time.
Why, doctor?
Why? I mean, no air should leak out. If you will not pinch the nose, whatever breath you will give, that can come out from the nose. That we don't want. Okay. So just head tilt, chin lift, and pinch the nose, and we have to give a normal breath. Normal breath. And look at the patient's chest. Okay. So let me show you one. Okay. This is how we give rescue breath. So it should be a normal breath and keep looking at the patient's chest. And after that, again start with your chest compression.
Okay.
Again, then rescue breath. 30:2. That is the ratio we have to make sure we have to follow. Okay. Okay. And any idea, Alex, when we should stop?
When the help arrives?
Yeah, absolutely right. Anything else?
I think when you get tired.
Yes, of course. And if our patient shows any sign of life, so that at that time we should stop. Okay.
Yes.
I hope I was clear.
Yes.
Could you please show me how? I mean, if you learned properly, or if you have any doubt.
Okay.
Yep.
I can try at least.
Yeah. Please.
Okay. Okay.
Yeah, Alex, that's good. I just want to make small changes. Like as I mentioned, like our elbow should be straight. And it's better if you will count it loud whenever you're giving chest compression.
Okay.
Yeah.
1, 2, 3,
and
4,
5 to 6 centimeters
6, 7, 8, 9,
Don't bend
10,
your elbow.
11, 12, 13, 14, 15.
Excellent. But how many we should do chest compression?
30 followed by 2 rescue breaths.
Yes, perfect. So if you don't mind, could you please show me the rescue breath as well?
Yeah, okay.
Yeah, this must be you.
Okay, thank you. Okay.
Yeah.
Lift. Okay.
Yeah, just Alex, just one thing. It's better if you pinch the nose because we should not make otherwise air will leak out.
Okay.
Yes.
Okay.
That's great. Yeah, that's great. Yeah, and it should be normal breath.
Okay.
Yeah.
I missed it.
Okay.
Thank you, doctor.
Thank you.
Thank you for your help.
Thanks.